We live in a society that has forgotten about the HIV status, only because of the elevations of illegal drugs and sexually transmitted diseases. We've been put back on the back burner, and the younger generation is catching it and are growing up dealing with it. Their attitude is not like mine, because when I got this illness, this disease, this wickedness, women weren't even considered a part of it, so they weren't being tested. It was mostly males, gay males at that. In the African American community, we don't address our sexuality, even though we're the most religious people in the world. You know, over the years has been very stressful. I had a husband who had HIV/AIDS and didn't address it to family members and lied. I had to deal with a son who I didn't tell him that he had it at first. I lied and told him that he had allergies because of my own shame. I've had a lot of stress to do with my family, and when your son, when he feels as though because he was born with this illness that he doesn't have the same struggles that you do, that's stressful. He's kind of like a hermit, so he's isolated. He has isolated himself, and he feels as though he can't live a normal life because of this disease. When I first got it, I thought I had a cold because I had been sick for a couple of weeks. One day I just couldn't breathe properly, so I went to the ER, U of L hospital, and that's when I found out. It was very hard. You have to learn to adjust to the changes in your life and to not feeling good, and that was October of '98. But through the years, I've learned to accept it, and there for a while, the meds, they were a challenge because they were bulky, they were chalky, they burned. They hadn't really developed anything yet. Now, once a day, I take 4 pills, and that's a great obstacle to be able to overcome because pill taking is not fun. And over the years, I would forget to take my meds, so now I put them in a pill case with the days of the week on it, and that really helps me to remember. Over the years, I've had care coordinators who have been there for me. I had 1 or 2 doctors who really inspired me to not give up and to not be concerned with society and their ideologies. I really like my current doctor. He's good and he talks to you and you can talk to him, and having someone who specializes in this illness is really good. It helps you know that there are advancements and possibly a cure. When you have a doctor who has compassion and is not just giving you medical terms, it keeps you upbeat and it keeps you coming back to them. But when I first got it, when I was first diagnosed, there were a lot of healthcare coordinators who felt like their lives were in jeopardy just for the simple fact that they were dealing with this illness, disease, or epidemic. They hadn't developed compassion yet, and at the time, U of L was pretty much the only place that you could go. My doctor, who was in development and research, by the time she left in the mid-2000s, I could see a change in people's ideologies and perceptions of the illness. The people at the House of Ruth were very helpful too. I lived on campus where they helped me out a lot with food vouchers and stuff of that nature. I've had jobs and I work and I would receive my disability, but you can only work so many hours and then they cut off your disability. There have been times when I needed help, and one of those organizations were always there to help me in some kind of way. It could be food pantry or bus tickets or something. But I know due to funding, things have changed, so I try to be more independent. The thing is, we have to be more willing to disclose, even though it's caused me to lose my job, to be fired, and to be incarcerated. Hiding it does not help. It only makes the stigma worse. It's really sad because the older generation, they have a stigma, and they're the largest number of people getting HIV right now for the simple fact that they think they can't have it because they're old. And I'll be like, okay, Mom, but remember, anybody can have it. You can be standing in front of them. You could be looking at them in their face. You could be talking to them. You don't know what's in their blood. I think the future is all of us being strong enough for those of us with HIV/AIDS to be integrated into society. I believe we're the seed for the plant to grow. Being an older American with this disease is not detrimental. You can still succeed. Don't be concerned with society's views on you. It has made me a very strong person. I've had friends come and go due to this illness. Some would just mistakenly not take their medicine. Other ones, they gave up. And when I say gave up, they just stopped popping the pills. But I think we have learned from our mistakes and our regrets and from watching others that when you get this disease, it puts you totally as an outcast, but we're really strong people. Every day we need to look into the mirror and say, nobody can mess with me. I'm all that.